Welcome to We Can Be. I'm your host, Chris DeCardy. As political campaigns this past year surrounded us with ads focusing on immigrant communities and fracking, today's guest brings a unique vantage point to both of those topics. Tammy Murphy is the Public Policy and Advocacy Manager for Make the Road Pennsylvania, a nonprofit that builds power for justice in Latinx, immigrant, and working-class communities of color. Climate and environmental justice are primary parts of their work. I first met Tammy when she was speaking at a convening of environmental funders last year, where she shared something attention-grabbing. At the time, she was the advocacy director for Physicians for Social Responsibility, and she was describing her experience working with families whose lives had been impacted by the adverse health effects of fossil fuel extraction. She said to the group, "It's hard to talk about families who are losing their children, their spouses, or who have kids doing homework in hospitals because their parent is dying." Those interactions have helped make Tammy fearless in speaking with and for families in the corridors of power, evident from the demonstration she led at the Pennsylvania State Capitol several years ago with parents of children affected by fracking-induced health issues. That dedication has led to her being a trusted advisor for both the Department of Health and Department of Environmental Protection. Tammy, I am really excited to have the opportunity to talk with you today. Let's start with some background on what we mean when we talk about the adverse effects of fracking. What is fracking and what are its dangers?
So fracking is a process otherwise known as unconventional gas development. They pump a ton of chemicals and water into the ground and sand, and it creates fissures which allow for the gas to come out, and then they basically suck up the gas. And with it comes not only the material that they put into it and the gas that they were trying to extract, but also things like radioactivity that exist, miles deep down in the earth. The radioactivity sticks to the pipes. It sticks to the material of these facilities, and it builds upon itself. It keeps coming through, and then it sticks. And because it attaches itself to other things, it's traceable. Most of us kind of thought that it's going to be much heavier in the area where there's fracking, and then it would dissipate and maybe not even be traceable by the time it got to the export areas. And that's not what we found at all. It's actually that low level is pretty consistent, whether you're in the area where it's drilling or in the areas where we're transporting it out of the state or even out of the country. We can't always trace benzene or something else that's in this mix, this toxic mix. But what we're finding with the radioactivity is that that other stuff is traveling with it. So there have been studies about even the gas that we're using in our homes and our stoves, that there's a lot of the material that we're afraid of at the drilling site that all the way at the end use product, that's also coming out and exposing us in our homes.
Just looking at fracking, Frack Tracker data says there are 1.1 million active fracking sites in 36 states across the country, and that almost 18 million people live within a mile of an active oil or gas drilling site. How does Pennsylvania play into that mix? How much of this is in Pennsylvania? How big a deal is it in Pennsylvania relative to other parts of the country?
It's huge in Pennsylvania. I think we are the second, close to the first. We're, between Texas and Pennsylvania, we're the top extraction states. The amount of wells that are drilled, nearly 220,000 in Pennsylvania that are either drilled or proposed. People's level of exposure is incredibly close. And it's not just the drilling. I think a lot of people often think of fracking and they think just where the site is. But the industry, its fingers are all across the state. There's pipelines, there's compressor stations, there's pumping stations, there's storage sites. It's taken from the ground here, but largely exported. So that process actually puts people in danger far away from the well pads. Compressor stations, by design, emit the toxins. That's how it works. That's how they keep it flowing through the pipeline, is to emit some of it. And then there's what I think of as a monstrosity in Monaca, Pennsylvania, where the Shell cracker plant is. It's a wildly large facility, and it's not that far from people's homes. And there's so much happening there and so many violations. It's indicative, though, of what we're seeing elsewhere throughout the state. Our radioactive emissions study showed us that just about every site that we went to, there was radioactivity everywhere. And for the most part, other than 2 sites that were above what would be a legal limit, everything else was within a legal limit. But what is considered a legal limit is really very far from a public health guideline for safety.
Working on the set of issues is something that we've supported at the Heinz Endowments for quite a long time. We've had the opportunity to work with you and support a lot of the organizations that you work in coalition with. Our senior program director who leads this work is Phil Johnson. And so we asked him to have a specific question for you. So here it is.
Hi, Tammy. This is Phil Johnson, Director of Environment and Health at the Heinz Endowments, and a longtime admirer of all the work that you've done in the region, for which we're deeply appreciative. My question has to do with the contrast between our region, which has been fracking for many years, and other regions in the country and internationally, which have chosen not to frack, in light of the concerns and risks to public health and the environment. Maybe you could talk a bit about these contrasts and what would make a region not frack or frack in light of the same evidence.
That is a very good question. And there are a lot of areas that don't frack. I think some places like Vermont were scared of the practice, and it turns out they don't have much gas there, so it probably wouldn't have been a target. But there are places like Maryland that do have shale gas, and it would be a profitable industry there. And New York, they've gone about it different ways, but they have both banned fracking at this point, largely based on the studies that have been done in Pennsylvania. The conclusion at this point, and for quite a few years now, has been that there really is no safe or healthy way to frack. And there are states that recognize this. Then there are states in Europe that, some of them, for similar reasons, just for their own population's health, decided not to do this based on the impact that fracking has on the climate. And then there are countries that we have worked with, including Ireland. The stories that we have shared with them of our Pennsylvania community members who have been exposed to the chemicals and are either sick themselves or have lost family members, these stories are considered human rights violations. And although we sign a lot of the treaties that, would make us obligated to follow them, but our government doesn't ratify them. In Europe, these countries have ratified human rights treaties and are held liable for violations of human rights, and then people are rejecting it because they're seeing what Pennsylvanians are experiencing as violations of human rights.
My name is Lois Bauer Bjornson, and I am the Southwestern Pennsylvania Field Organizer with Clean Air Council. I live in Washington County, Pennsylvania, the most heavily fracked county in Pennsylvania. My oldest son, when he was 10, 11, would have been about right, he had a rash all over him, even on his ears. And it was like a bumpy rash. It wasn't red, but it was everywhere. It didn't itch, it didn't do anything. My third son had probably the worst impacts ever. I couldn't keep the windows open anymore because he would get nosebleeds in the middle of the night, and then he'd have a couple through the day where he would turn like anemic looking and pale and clots coming out of his mouth. He had a couple at school and was like, "Don't tell my mother." So it was just those type of things that, then you would start to correlate. Oh, there's a new well pad over there. Oh, there's 3 over here.
The Pennsylvania stories were impactful in New York and Maryland to make a different state-level decision about fracked gas. Why didn't that happen in Pennsylvania?
In New York, they managed to get the language of health and the focus on health ahead of the language of jobs and the economy. And that was largely done because they got that language of health out there before people had the jobs and before people were profiting and making the money. Really getting that message out there first was the powerful piece. It was a much, much harder hill to climb when people are making money off of it. Families are reliant on it. Communities are reliant on it. The industry has a hold of our politicians. So it's been a very different process. And not to toot my own horn too much, but if you look at the headlines today, compared to when we started this about 7.5, 8 years ago, the language in the newspapers was only about jobs. And you might get a little snippet somewhere in the fine print about the health. And today, almost all of the headlines are about health. even the industry is writing about health. They're arguing about it and they're saying they don't like the studies or something, but they're talking about it. And that's all there is left to talk about at this point, really.
But what are the specific health impacts of that kind of exposure above and beyond what is considered safe from the medical community?
So I have a funny memory. I guess it's a little, it's not really funny. I guess you'd have to be doing this for too many years to find this funny, but I have been. So. My colleague Laura gave a fantastic speech in the Capitol Rotunda one time, and she was talking about the health impacts of fracking, and I'll read it to you. Laura is a nurse, and she gave this speech years ago and said that the symptoms reported by residents living near gas drilling sites include increased skin rashes, nausea and vomiting, abdominal pain, difficulty breathing, coughs, nosebleeds, anxiety and stress, headaches, dizziness, eye and throat irritation, and increased rates of hospitalization, a number of patients with heart and skin conditions, as well as tumors and urological conditions, chronic sinusitis, and fatigue systems, and asthma exacerbations. And the reason that we kind of chuckled when she did it a bit faster than I did just then, but she really sounded like she was doing one of these like FDA, requirements that the pharmaceutical ads have. So you hear all of this. Of course, it's going to be great. And that's what we heard with fracking. It's going to be wonderful. It's going to give us jobs and it's going to be better. And it's a bridge fuel for climate change issues. And so we hear all of this and then you have to give that little warning that you could die from it.
I'm imagining that I turn on my stove at home, and every time I turn it on, I've got this speed play of what that warning is while I'm boiling the water for the soft-boiled eggs or something in that mix. I suppose a gallows humor in it. So how does the government set standards, and how should the people of Pennsylvania think about those standards related to their health?
So when it comes to radioactive emissions, when people started working with radioactivity, there wasn't a great base of knowledge for it. And they kind of guessed. The majority of these regulations are for workers who are in protective gear and work 8 hours a day and then leave. So it's a very different experience than workers in the fracking industry that are exposed, where some of the sites, some of the locations within the industry aren't even required to call it hazardous material. And over the years, some of that has changed, but some of it still hasn't. And other than the workers, we also have families. So some of the workers are bringing some clothes home and boots and things like that are covered in radioactive emissions and putting it in the laundry with your family's clothes. We did some of our studies on people's properties, and they had elevated levels of radioactivity in the areas where they live, work, play, go to school. It's a low level of exposure, but when you're exposed at such a consistent rate, day in, day out, there's not really an escape from it. It's at the high school on the football field. It's also present in the home where you live or in the stream that runs by your house. The exposure is so consistent that your body doesn't really have a chance to recuperate. So the government regulations are for consistent exposure in a workplace with protective gear, set time of day, lots of monitoring and safety precautions put in place. So the levels where the government is saying is safe, that's not for somebody who's at any point in their own home or their own workplace or their school having this constant level of exposure.
In a place like Pennsylvania, where we have 220,000 drilled or proposed wells, those standards have been violated in the last 15 years, I think by your website, more than 70,000 times. So in addition to a standard initially that you and your organization has raised concerns about how that standard was set and for who, there are also violations. Can you describe what a violation is and what happens when there's a violation?
Well, a violation is when there is some kind of like a spill or something like that where people have exposure. Things are not operating the way that they're permitted to operate. For example, if you're thinking of a compressor station that is permitted to release a certain amount of chemicals, they have to do it on a certain date when they're allowed to do it. They can only do it for a certain amount of time. If you had a really good optical gas imaging camera, you might be able to find a compressor station that is emitting constantly. And then you find that there's no permit for that time. And that at no point was the government permitting that release of the toxins. If there's that many wells, then there's also that many pipelines, compressor stations, pumping stations, all of the different pieces of this industry, it would be impossible for the Department of Environmental Protection to have eyes on them all the time. The industry largely reports on itself. And with 70,000 of them in the last 15 years, that's when they were caught.
You mentioned that you represent and work with people who are closest to the impacts on the ground in communities, and then have an audience of policymakers, and trying to connect those two together. Why is that important for getting the change that you want to see in the world?
Policymakers, they work in a very different sphere where they're dealing with a lot of issues, and they tend to be governed largely by what is politically possible. There's a kind of bureaucratic thing that's based on statistics and data and numbers and things like that has a very different feeling than when you know people and you know their stories. Bringing the two together for us has been really important. Having them meet people and see the industry and how it impacts people has really, I think, turned around the idea of just doing a study or just understanding the statistics.
Is there a story that you can tell, an example from somebody who has made that connection that was particularly compelling to you and helped people and families who might not have that access have their voice connected? Is there a story that jumps to mind that's helped make the type of impact you just described?
Janice Blanock, who lost her son Luke to Ewing sarcoma. Janice has been very, very outspoken about her concern that Ewing sarcoma that her son experienced could be related to the fracking industry. And she has adamantly pushed for evidence or studies into that. And her story is incredibly compelling. She had a very healthy, happy teenage boy who fought a very, admirable and brave fight against Ewing sarcoma, but eventually succumbed to it. Her commitment to finding out if that was possibly what caused the Ewing sarcoma. And really, she's curious, of course, for her own sake to find out what happened to her son. But the thing that really drives her, honestly, is that she doesn't want anyone else to experience it.
This morning, we have new data on how fracking can impact the health of our children in our area.
University of Pittsburgh researchers found children who lived within 1 mile of one or more natural gas wells had a 5 to 7 times the chance of developing lymphoma compared to children who lived in an area without wells within 5 miles. The state of Pennsylvania funded these studies after Ewing sarcoma had been diagnosed to dozens of children and young adults in heavily drilled area outside of Pittsburgh to try to determine possible associations. Live in Oakland, Jessica Guay, KDK TV News.
So how do you engage with folks over time that you're working with? In addition to hearing their stories, how else do you and the organizations you partner with involve communities?
We work really closely with some of the grassroots organizations that are closest with the residents. That's really important to us, to build a relationship with them so that we can basically take our direction from them. Organizations like Center for Coalfield Justice or Mountain Watershed Association or BCMAC, they know their communities best. They know who's been dealing with what. They know who's ready to talk about their story again and who's not. And we trust them to gather the information, get the feel of what the people want to do and what kind of actions they want to take. And we basically take our direction from them. We work with Justin Noble, who's been working on radioactivity. So we conducted a study on radioactive emissions, and we collected air, water, and soil samples. We started collecting different kinds of data, and we put together basically an air monitoring system that is both qualitative and quantitative. And we're basically surrounding facilities to the best of our ability, and that's collecting the quantitative data. And then we have a platform where people can put in the impacts that they're experiencing or the symptoms that they're experiencing. A nosebleed or a headache or fatigue. They're feeling something or they're seeing something or they're smelling something. And they can put this qualitative data into a platform, and then we can see where they overlap and then see if it's specifically that facility or if it's in that region. And we also managed to recently acquire a optimal gas imaging camera. It's an incredibly powerful camera. You can look through it and you can see pollutants that you can't see with the naked eye. So we can go on to a facility, and too often we are seeing that there are emissions coming out of facilities when as far as we know, they're not permitted to do it. Really, we're using this tool as a way of gathering this information and then coming back to regulators and asking them questions and making them answer, because this is really the job of the government to do this. So we're not pretending that we know exactly what everything is, but this is a way for us to validate what people are saying that they're feeling and smelling, and then we can see it. And then it's up to the government to ask us, what is this? What is this industry doing? You're supposed to be the oversight.
What role does the government play on this? What is important about their role? The concern also could be directly to specific companies or specific players in an industry in this mix. Why government? What level of government? And what do you want them to do?
There's lots of layers of the government that we are working with. Down at the municipal level, we're doing some work there with ordinances and things like that. And it just kind of goes up the ladder, into state representatives and agencies. We work with regional partners and federal partners and also international partners. This is a network, and the industry works as a network and operates as a network. What Shell is doing here and what they have done in South Africa matters. They will repeat a lot of the same things. How they deal with communities is not usually that different in one place or another. And the industry has its own associations that are also local, state, regional, federal, international. And so we have to work with our partners on all of those levels within the community. And then in between us, both, is the government. I think the idea is that the government protects the people, and too often the government is protecting the industry. It's not always working in the direction that we would like it to or that people expect it to. So I feel like we use the government to leverage what the people want, knowing that the industry is doing the same thing. They're using the government to leverage what they want.
In general, in this conversation, we've been talking about people and people who are closest to the negative consequences from this industry, but it doesn't impact everybody the same. Can you talk a little bit about who does get impacted the most in our society? And then how do you think about that disparity in your work and making sure that that's brought forward in the right kinds of ways?
Where these facilities are located are usually in the places where, globally, when you look at this, they find the place that has what they want in extraction, and this could be, any kind of mining or any kind of extraction. They find the product that they want to go after, and then they find the path of least resistance. They're going to go into the communities that they find the most vulnerable and try to extract from there in a way that doesn't disturb the people with the most power, because they're going to resist them, they're going to report them to the government. They're going to be working with doctors and lawyers in that community who can fight the fight for the community. They would prefer to work sort of in the shadows and promise people things like jobs, tell them things like this fracking industry is going to help climate change, which of course we know it did the opposite. They work in ways that target communities that are already usually dealing with too much of a burden from so many other things in life. So they're going to go after communities of color. They're going to try to operate from there. They're going to put a facility in a community of color or a rural community that has a very low population density. When there's like 24 people within a couple mile radius of this facility, 24 people may or may not be opposed to it, but those that are opposed to it within those 24 people might not have the kind of power that can get their government to say no to this, especially if there's any benefit to the local government. So there's environmental justice communities for people who are poor, for people of color, for people who are often understood to be living under oppression, and then also including rural communities that, because of their low population density, also have a hard time fighting these industries. And that's really where these places are located.
You have a story that's kind of close to home. You live in the Philadelphia area and I think played a part in coordinating what was a citywide coalition in an effort to prohibit and then appeal permitting for a proposed power plant in the Nicetown neighborhood on the grounds of environmental racism. So how do you define environmental racism? And can you share some of what led to the effort and what has happened?
Certainly. Environmental racism, it's just the concept that I was speaking of, where they're literally looking for that path of least resistance. And when you're in a community that is already dealing with the burden of a society that is really at a default, it's racist unless you're anti-racist. They were designed to put these facilities, toxic facilities, things like that, that would be a nuisance everywhere from smells to sounds to anything that would be a nuisance in a community. They put that in the poorest, most vulnerable community. So in Philadelphia, there was a deal made that they would put this gas plant in. And of course, when they decided to do that, they didn't put it uptown in Chestnut Hill or somewhere else that is largely white and largely a wealthier community. They put it in Nicetown, which is vast majority of the community is Black. And specifically at the time when they were permitting this, Philadelphia had just done an economic study, and that neighborhood of Nicetown was the neighborhood that had the largest increase of poverty. At the same time that they were also trying to put in this power plant that was going to make people sick. A huge problem with it was they were not really taking in the cumulative impacts. 1/3 of the children have asthma, and that is the diagnosed statistic. And that does not mean that every child that has asthma or is experiencing asthma is actually diagnosed. This statistic is probably actually quite a bit higher. There's a reason that many children have asthma. There's highways that run through it. There are multiple bus depots and multiple reasons for exposure to other toxicities. And the air sample that was taken from an area way on a different side of town that we would not have the same air quality. The community was incredibly vulnerable and not protected by environmental justice laws. But there is a lawsuit, or a potential lawsuit, I should say. It's on the path of a lawsuit. It's basically like a complaint at this point with the EPA that environmental justice laws should have been followed, but weren't. That's a case of environmental justice where you're seeing direct environmental racism. There's no consideration for the burdens that they already carry. And these are the kinds of things that, like, the laws were removed a long time ago for segregation, but the practices have not been.
So you've just painted a vivid and compelling picture of the multiple forces at play historically and currently that clearly animate your work in working in community and with communities. Where does that come from you? Why this work? How did you get into this work? And what's the motivation that keeps you going in situations that are difficult against entrenched interests that have an awful lot of power?
I think I'm driven by a desire to see justice. As a child, I saw injustice and recognized it early, and I think in ways that not everybody around me did. I mean, no, they didn't, because I think a lot of kids thought I was kind of weird and worried about these big world issues when I was just a little kid. My grandmother grew up in an orphanage, and her sisters, each as they took their turn coming out, as they aged out of the orphanage, the oldest sister had the apartment, and they each moved in and picked up their picket signs and started fighting for women's suffrage. So I think that part of my family history was there. And then I was young and looking at things like the Gulf War, and I could just see the injustice of it. It was, to me, horrible. It was greedy and wrong. It wasn't protective. We weren't in danger, but people were dying. And that, to me, was, a clear form of injustice. And as a child, I was really bothered by that. I was also really deeply bothered by racism that I saw in our own community and in our own world. It was prevalent, and these things stood out to me dramatically. And I don't know where that comes from. Just having this real sense of like right or wrong and societal's right and wrongs and being concerned about it. When the Iraq War was raging and I was again watching a government doing these horrific things for what I felt like was all the wrong reasons, I studied international peace and conflict resolution at Arcadia University. Although I was terribly intimidated by law, I was most attracted to the law element in that program because I saw the law as the leverage that communities had to get what they wanted and what they needed and to find that source of justice. I also understood it as I studied this, and then I went on to study a master's degree in University of London, the School of Oriental and African Studies, that law is a double-edged sword, and it works both ways. The industry is going to use it, and we're going to use it, and there's lots of different pathways. You have policymakers, and you have regulations, and you have lawsuits, and all kinds of things, and the industry might have a ton of money, but we have millions of people. And you learn to wield that social movement power, that strength that comes from people in numbers and people speaking their truth and people who know how to elevate them, doing the work to elevate them.
So the name of our podcast is We Can Be. I'd like to end each episode with this question. What do you think we, as a community, country, and world, given everything you just described, what animates and motivates you, what can we be?
I like to believe that we can be liberated and that we can live in peace.